Hey, Dr. Tracy, I'm a board certified general pediatrician, and I wanted to talk to you about strep throat. So this is a picture of what group A strep or strep throat looks like in a child. This is really common. I think most people understand this is a bacteria. It's spread by saliva from person to person, really common in school-age kids. The problem with strep throat isn't the bacteria itself. It's not so much that it causes a sore throat and a fever. It's that it can cause rheumatic fever, where the child has a fever, a certain kind of rash, and the bacteria can infect the heart. That is the main reason that we treat strep throat. Group A strep is a pretty dumb bacteria, so it will get better on its own. And studies show that most of us get infected with group A strep a few times a year, and we clear it on our own. So there's something that happens in general pediatrics and primary care where children under the age of 3 are exposed to strep, and we don't test them or treat them. And this is really confusing for families, so I wanted to explain why. So studies show that children under the age of 3 don't typically get strep throat. They don't look like this. The most that they're going to get is a mild cold, and that cold cannot lead to rheumatic fever. So if it doesn't lead to rheumatic fever, we don't need to test for it and we don't need to treat for it because, again, group A streptococcus is going to get better on its own in most cases. So children under the age of 3 cannot get rheumatic fever. So if your pediatrician or primary care provider is seeing your child who's under the age of 3 and they have been exposed to strep throat at either daycare, school, or by a sibling or by the parent themselves, and your primary care provider states they don't need to test them for it and they don't need to treat them, this is why. Children will get better on their own. Antibiotics are not needed. We want to be better antibiotic stewards, meaning we only use antibiotics when they're absolutely necessary, because the reason to use an antibiotic is to prevent complications. And if there's no complications for strep under the age of 3, we don't need to use it. Are there exceptions to this rule? Absolutely. So if your child is not getting better, has severe symptoms, follow up with your primary care provider and let us make that decision in person. But in general, under the age of 3, you can't get rheumatic fever. Therefore, the test is not accurate to test for group A strep, and there's no reason to treat with antibiotics. So I hope this helps. Take care.